What if I told you that the most dangerous activity you participate in every single day is not driving your car or climbing a ladder, but simply closing your eyes and drifting off to sleep? We tend to view our beds as the ultimate sanctuary of safety, where our bodies recover from the wear and tear of daily life and where our minds process the memories of the day. However, for anyone over the age of 60, the specific way you position your body on the mattress could be silently increasing your risk of a catastrophic medical event. I'm speaking specifically about an ischemic stroke, which can strike without any warning signs while you are completely unconscious and unable to reach for the phone to call for help. As a medical professional who has spent decades analyzing the complex relationship between neurology and lifestyle choices, I was genuinely alarmed by what the latest data reveals regarding sleep positions. A groundbreaking study published in the prestigious Journal of Clinical Neurology found a direct and undeniable correlation between certain neck positions and restricted blood flow to the brainstem. You might assume that your body possesses an innate wisdom that naturally finds the safest position, but unfortunately, comfort does not always equate to safety, especially as our arterial walls age. When we are young and resilient, our blood vessels are like fresh rubber bands that can handle twisting and turning and stretching without compromising the vital oxygen supply to our brain cells. But after 60 years of constant use, our arteries can become stiffer and far more susceptible to a phenomenon known as mechanical compression during long periods of immobility. Imagine a garden hose that is carrying a steady stream of water to a delicate flower bed, and now imagine kinking that hose tightly for 8 hours straight while expecting the water to flow perfectly. That is exactly what millions of seniors are doing to their vertebral arteries every single night, without even realizing the mortal danger they are placing themselves in. Today, we are going to expose the 3 deadly sleep positions that you must stop using immediately if you want to protect your brain health and preserve your independence. We will also reveal the #1 surgeon-approved sleep position that actually helps flush your brain of toxic proteins while you rest using the power of gravity. This information is so vital that it could literally mean the difference between waking up refreshed and energized or facing a medical emergency that changes your life and the lives of your family forever. Before we dive deep into this life-saving information, please take a moment to tell us in the comments where you are watching from and your current age, because we love connecting with our global community. We read and reply to every single comment, so please do not hesitate to share your story or ask a question that has been on your mind. Let us begin by thoroughly understanding the delicate anatomy of your neck, because this is the master key to understanding why certain positions are so hazardous. Your brain is a ravenous organ that demands 20% of your total blood flow despite making up only 2% of your body weight. This constant supply of oxygen and nutrients is delivered by 4 major highways, which are the 2 carotid arteries in the front of your neck and the 2 vertebral arteries running up the back. The vertebral arteries are particularly vulnerable because they thread through small bony holes in the vertebrae of your spine called the transverse foramina before entering the skull. When you twist your head to the extreme left or right, you are effectively stretching and compressing these delicate vessels against the hard bone of your cervical spine. In a young person, this is rarely an issue because the vessels are flexible and the redundancy in the system compensates for the temporary restriction. However, in an older adult who may have hidden plaque buildup or atherosclerosis, this rotation can reduce blood flow to a critical level. This brings us to the first and perhaps most dangerous sleep position that you absolutely must avoid after the age of 60 if you value your brain function. The stomach sleeper position is one that many people have favored for their entire lives because it feels grounded and prevents the sensation of falling. However, biologically and mechanically speaking, sleeping on your stomach is an absolute nightmare for your cervical spine and your cerebral blood flow. Think about the physical mechanics required to lie flat on your stomach while still being able to breathe comfortably throughout the night. You cannot breathe face down into the pillow, so you are forced to rotate your head a full 90 degrees to either the left or the right side to clear your airway. You then hold this extreme end-range rotation for hours at a time, which places enormous torque and shear stress on the structures of your upper neck. Research has shown that this sustained rotation can reduce blood flow in the contralateral vertebral artery by a significant percentage, often exceeding 50%. If you have any existing plaque buildup or atherosclerosis, which is incredibly common after 60, this reduction in flow can be the tipping point that causes a clot to form. There is also a documented condition known as Bow-Hunter syndrome, where turning the head mechanically occludes the artery, causing fainting or dizziness or stroke. While that is a specific clinical diagnosis, the underlying principle applies to everyone to some degree when the neck is twisted so aggressively for such a long duration. Furthermore, stomach sleeping forces your spine into an unnatural arch that compresses the lower back and completely flattens the natural lordotic curve of the neck. This compression can irritate the delicate nerve roots that exit the spine, leading to numbness and tingling in the arms and hands upon waking up. If you often wake up with a stiff neck or a headache that starts at the base of your skull, you are likely traumatizing your arteries and nerves every single night. The risk is not just about blood flow restriction, but also about the potential for damaging the inner lining of the blood vessel itself, known as the tunica intima. This damage can lead to a dissection where the inner layer of the artery tears and creates a flap that blocks blood flow like a trapdoor closing shut. A clot can then form at this injury site, and if that clot breaks loose, it travels directly upward into the brain, causing an ischemic stroke. This is why neurologists often cringe when they hear patients say they have been stomach sleepers for decades and refuse to change their habits because they are comfortable. The cumulative stress on the ligaments and blood vessels essentially ages your neck faster than the rest of your body, creating a biological weak link. Now, let us move on to the second dangerous position, which is often mistaken for a healthy one by people trying to alleviate back pain or heartburn. I'm referring to the high pillow soldier position, where a person sleeps on their back, but with their head propped up far too high on multiple pillows. Many seniors add an extra pillow or use a thick reading pillow to prop themselves up, thinking it will help with breathing or reduce the symptoms of acid reflux. While elevation can indeed be beneficial for reflux, if it is done incorrectly by bending the neck forward, it becomes a serious stroke risk factor. When your chin is forced down toward your chest for the entire night, you are creating a structural blockage in your airway that is similar to drinking through a bent straw. This position mimics the damaging head posture of looking down at a smartphone, which we know places up to 60 pounds of pressure on the cervical spine. But the more immediate danger during sleep is the restriction of the windpipe and the subsequent drop in oxygen levels in your bloodstream. This specific posture significantly increases the likelihood of obstructive sleep apnea, where your breathing stops and starts repeatedly throughout the night. Sleep apnea is one of the strongest independent predictors of stroke in older adults because it causes massive and dangerous fluctuations in blood pressure. Every time you stop breathing, your oxygen saturation drops, and your brain sends a panic signal that spikes your blood pressure to force air into the lungs. These nightly adrenaline and blood pressure spikes put immense strain on the delicate blood vessels in your brain, causing them to weaken and bulge over time. A massive study from the American Heart Association found that untreated sleep apnea increases the risk of stroke by nearly 4 times in people over 60. By sleeping with your neck hyperflexed forward, you're mechanically inducing or worsening this condition every single night without even realizing it. Additionally, this forward head posture compresses the jugular veins, which are responsible for draining waste-filled blood out of your brain and back to the heart. If blood can get into the skull but cannot get out efficiently, it increases intracranial pressure, which is another significant stressor for your neurological system. You want your neck to be in a neutral alignment, where the ears are directly in line with the shoulders, not pushed forward by a mountain of pillows. The goal is to maintain the natural cervical curve so that the airway remains wide open and the blood vessels are unkinked and free-flowing. If you need elevation for heart failure or reflux issues, you must elevate the entire upper body using a wedge pillow or an adjustable bed frame. Simply shoving pillows under your head bends the neck like a hinge and cuts off the vital flow of life-sustaining fluids that your brain relies on. Now we must discuss the third dangerous position, which is a variation of side sleeping that creates a trap for your heart and your lungs. This is the tight fetal position, especially when curled up on the right side with the chin tucked deeply into the chest and knees pulled up high. While side sleeping is generally considered good, curling up too tightly into a ball compresses the diaphragm and restricts full lung expansion. As we age, our lung capacity naturally diminishes, and our rib cage becomes stiffer, making deep and efficient breathing more difficult. When you curl into a tight ball, you're physically preventing your diaphragm from descending fully, which leads to shallow and rapid breathing patterns. This shallow breathing results in lower oxygen saturation levels in the blood throughout the night, depriving the brain of what it needs most to repair itself. Furthermore, sleeping on the right side specifically can be problematic for those with certain heart conditions or severe acid reflux issues due to gravity. The anatomy of the stomach allows acid to flow back into the esophagus more easily when gravity pulls it down the wrong way on the right side. Chronic acid reflux is not just a heartburn issue, it can lead to microaspirations, where tiny droplets of acid enter the lungs, causing inflammation. This systemic inflammation raises levels of C-reactive protein in the blood, which is a known marker for increased stroke and heart attack risk. Additionally, the tight fetal position often involves tucking the arms tightly against the chest or under the head, cutting off circulation to the extremities. This can lead to compression neuropathy, where the nerves in the arms are damaged, leading to weakness and loss of function over time. But the most concerning aspect of the tight fetal position is again the extreme flexion of the neck and spine that occurs when you tuck your chin. Just like with the high pillow position, tucking the chin to the chest stretches the spinal cord and restricts the flow within the vertebral arteries. It is fascinating how many people revert to this position unconsciously, because it mimics the safety of the womb, but it is not safe for a senior body. So if these are the three positions that invite disaster, you are probably asking yourself, what is the solution for safe and restorative sleeping? The answer lies in understanding a recently discovered system in the brain that acts as a nightly cleaning crew for your neurons. It is called the Glymphatic System, and its discovery has revolutionized our understanding of why we sleep and how to prevent neurodegenerative diseases. During the day, your brain cells are hard at work producing metabolic waste products, including sticky proteins called beta, amyloid, and tau. These proteins are the same ones that clump together to form the plaques found in the brains of Alzheimer's patients and those with dementia. When you sleep, your brain cells actually shrink slightly to open up spaces between them, allowing cerebrospinal fluid to wash these toxins away. However, this washing process is heavily dependent on gravity and the physical position of your head and body on the mattress. A study from Stony Brook University used advanced magnetic resonance imaging technology to watch this cleaning process happen in real time in different positions. They discovered that the glymphatic clearance was most efficient when subjects slept on their side, but in a specific neutral alignment. This brings us to the gold standard of sleeping positions, which surgeons and neurologists recommend for longevity and brain preservation. The best position is the lateral side, lying position, preferably on the left side, with a pillow between the knees and the neck aligned. Let me explain exactly why this specific configuration is so powerful for your health and how to do it perfectly to maximize the benefits. Sleeping on the left side uses gravity to help the heart pump blood more easily to the rest of the body, specifically through the aorta. The aorta, which is the largest artery in your body, leaves the top of the heart and arches to the left side before running down the abdomen. By sleeping on your left side, you are working with the shape of this artery, allowing gravity to assist the circulation rather than fighting against it. This reduces the workload on your heart while you sleep, which is crucial for anyone with high blood pressure or heart concerns. The left side is also the magic position for digestion because of the shape and orientation of the human stomach, which is asymmetrical. The stomach is curved like a cashew nut on the left side of your body, so lying on the left keeps gastric juices in the main pocket. This dramatically reduces the risk of acid reflux and the silent inflammation that can damage your esophagus and throat while you are unconscious. But simply rolling onto your left side is not enough. You must ensure your spine is perfectly aligned to protect your neck arteries from torsion. This is where the pillow between the knees becomes a medical necessity rather than just a comfort accessory for older adults. When you sleep on your side without a knee pillow, your upper leg drops forward, pulling your pelvis into a twisted position. This twist travels up your spine, creating tension in the lower back, and eventually reaches the neck, causing a subtle rotation. By placing a firm pillow between your knees, you keep your hips stacked squarely on top of one another, maintaining a neutral spine from the base to the skull. This neutral alignment ensures that the vertebral arteries in your neck are straight and open, allowing maximum blood flow without obstruction. Now, let us talk about the pillow under your head, because this is where most people ruin the benefits of side sleeping by using the wrong gear. Your head pillow needs to fill the gap between your ear and the mattress, exactly so your neck stays completely straight. If the pillow is too thin, your head drops down toward the mattress, kinking the arteries on the bottom side of the neck. If the pillow is too thick, your head is pushed up toward the ceiling, kinking the arteries on the top side of the neck. You want your nose to align perfectly with your belly button, forming a straight line down the center of your body for optimal flow. It is worth investing in an adjustable pillow where you can add or remove foam to get this height exactly right for your specific shoulder width. For those who absolutely cannot sleep on their side, there is one acceptable variation of back sleeping that is surgeon approved. This is often called the zero gravity position, and it involves lying on your back, but with specific and deliberate modifications. You must use a thin pillow to keep your neck neutral and place a large pillow or a specialized wedge under your knees. Elevating the knees takes the pressure off the lower back and helps to relax the psoas muscle, which connects the spine to the legs. This position allows the spine to decompress and can be very beneficial for those recovering from surgery or with severe spinal arthritis. However, if you choose this back position, you must remain vigilant about the position of your head to prevent airway collapse. If you catch yourself snoring or waking up with a dry mouth, you are likely obstructing your airway and should switch to side sleeping immediately. There is another critical factor that interacts with your sleep position to determine your stroke risk, and that is your hydration level. Many seniors avoid drinking water before bed because they do not want to wake up to use the bathroom during the night, which is understandable. However, blood viscosity or thickness naturally increases overnight as we lose water through breathing and sweating under warm blankets. Thicker blood is much more likely to clot, especially if it is moving through an artery that is partially compressed by a bad position. While you do not want to drink a full liter of water, drinking a small glass of warm water before bed can save your life. Warm water helps to dilate blood vessels and ensures that your blood remains fluid enough to circulate smoothly through the brain. Now, I want to address a common question about what to do if you wake up and realize you have moved into a bad position during the night. Do not panic. Simply gently correct your position and take a few deep, slow breaths to oxygenate your system fully. Your body has defense mechanisms that will usually wake you up with pain or discomfort before permanent damage occurs to the tissues. The danger lies in ignoring these signals or taking heavy sleeping pills that suppress the urge to move when you are uncomfortable. Sedatives and alcohol depress the nervous system and can make you stay in a dangerous neck position for hours without waking up to correct it. This is why we strongly advise against using alcohol as a sleep aid, as it relaxes the throat muscles and worsens apnea significantly. Instead of chemical sedatives, try to establish a mechanical routine that encourages the correct sleep posture naturally and gently. One effective trick is to sew a tennis ball into the front pocket of a t-shirt and wear it backward to bed to prevent rolling over. This old-fashioned remedy physically prevents you from rolling onto your back and keeps you in the safer side, sleeping position all night long. Another technique is to hug a large body pillow, which prevents you from rolling onto your stomach during deep phases of sleep. The body pillow also provides support for your upper arm, preventing it from pulling on your shoulder and neck muscles, creating tension. We must also talk about the mattress itself, because a sagging mattress can sabotage even the best sleep position intentions. If your mattress is too soft, your hips will sink in deeper than your shoulders, putting your spine into a hammock shape that strains the neck. This curvature creates constant tension on the spinal cord and can lead to chronic microtrauma to the vertebral arteries over many years. A medium-firm mattress is generally considered the best choice for seniors, as it provides support while cushioning the joints effectively. If you cannot afford a new mattress, placing a piece of plywood under your current mattress can provide temporary support and firmness. Now I want to share a specific neck exercise that Japanese doctors recommend doing right before you lie down to sleep. This simple movement helps to align the cervical vertebrae and prepare the arteries for a night of optimal blood flow. Sit on the edge of your bed with your spine straight and your feet flat on the floor, grounding yourself. Slowly retract your chin straight back, as if you're trying to make a double chin without looking down or tilting your head. Hold this retracted position for 5 seconds, feeling the gentle stretch at the base of your skull where the arteries enter. Release and repeat this 10 times to reset your head posture after a long day of looking forward at screens or books. This creates space between the top vertebrae and the skull, where the vertebral arteries are most vulnerable to compression. Doing this nightly ritual sends a signal to your body that it is time to align and relax rather than collapse and twist. Another crucial tip is to ensure your bedroom temperature is optimized for brain protection and deep sleep cycles. A room that is too warm can interfere with the body natural cooling process, which is necessary for deep restorative sleep phases. The ideal temperature is between 60 and 67 degrees Fahrenheit, which encourages the natural release of melatonin. Melatonin is not just a sleep hormone, it is also a powerful antioxidant that protects brain cells from free radical damage. By sleeping in a cooler room, you are enhancing the brain ability to repair itself while you are in your safe side position. It is also vital to consider the air quality in your bedroom, as poor oxygen levels can exacerbate the risks of poor positioning. Keep a window slightly cracked open if possible, or use an air purifier to ensure a steady supply of fresh, oxygenated air. Plants like snake plants or aloe vera can also be helpful, as they release oxygen at night, unlike most other plants. Let us now discuss the timing of your last meal, because a full stomach can make safe sleeping positions uncomfortable. Eating a heavy meal right before bed forces your body to prioritize digestion over repair and can make side sleeping difficult due to bloating. Try to finish your last meal at least 3 hours before you lie down to allow your stomach to empty partially. This reduces the internal pressure on your diaphragm and makes it easier to breathe deeply in the recommended side position. If you must eat a snack, choose something light and rich in magnesium like a banana or a handful of almonds to promote muscle relaxation. Magnesium is a natural muscle relaxant that can help prevent the neck stiffness that often forces people into bad positions. Now, I want to touch on the psychological aspect of changing your sleep position, because it is admittedly very difficult. We form our sleep habits in childhood, and they become deeply ingrained in our subconscious mind over decades. Changing a habit you have had for 60 years is incredibly difficult, and it will feel strange and unnatural for the first few weeks. You might wake up a few times, finding yourself back in your old dangerous position, and that is completely normal and expected. The important thing is that you consciously correct it each time, retraining your brain and body to accept the new norm. Think of this not as just a sleep position, but as an 8-hour nightly therapy session for your brain and your heart. You are spending 1/3 of your remaining years in bed, so optimizing this time is the highest return investment you can make for your health. Your future self will thank you for the reduced stroke risk, the better memory, and the increased energy levels you will experience. Do not wait until you have a warning sign like a transient ischemic attack or a mini stroke to take this seriously. Start tonight by checking your pillow height and trying the left side position with the knee pillow for support. Remember that consistency is key, and even small improvements in your alignment can have massive long-term benefits. If you struggle to stay on your side, try wedging a pillow behind your back to create a gentle barrier against rolling over. This creates a cradle effect that makes you feel secure and supported without needing to resort to stomach sleeping. Another often overlooked factor is the lighting in your room, which can affect your sleep depth and movement. Sleep in total darkness, or use an eye mask to prevent visual stimuli from waking you and causing restless tossing and turning. Restless sleep often leads to ending up in bizarre and dangerous positions as the body tries to find comfort. By ensuring deep, continuous sleep, you are more likely to stay in the safe position you started in. We have covered a tremendous amount of ground today regarding the hidden dangers of your sleeping habits. Let us recap the 3 enemies of your brain health so you never forget them and can avoid them starting tonight. Number 1 is the stomach sleeper, causing severe neck rotation and vertebral artery compression. Number 2 is the high pillow soldier, causing airway obstruction and dangerous oxygen deprivation. Number 3 is the tight fetal crunch, causing diaphragm restriction and systemic inflammation throughout the body. And remember, the hero of our story is the supported left side position with a pillow between the knees for pelvic alignment. This position optimizes heart function, aids digestion, and clears brain toxins through the glymphatic system. We also discussed the importance of hydration temperature and mattress quality in supporting this safe position. Taking control of your sleep environment is one of the most empowering steps you can take for your longevity. It requires no prescription drugs, no expensive surgeries, and no grueling workouts at the gym. It only requires awareness and a willingness to adapt your habits for the sake of your future well-being. If you found this information eye-opening, please hit that like button so more seniors can discover these life-saving tips. We are committed to bringing you the most actionable science-backed health advice to help you live past 100 with vitality. We have more powerful videos coming that will challenge everything you thought you knew about aging and health. Make sure you are subscribed so you do not miss the next video where we will discuss foods that clean your arteries naturally. Thank you for watching and prioritizing your health and sleep well tonight in the safety of the correct position. We will see you in the next video with more secrets to staying young and strong and healthy.